Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 273 of the Ask Dr. Angela podcast. What's crack-a-lackin'? It's been a minute. I've been busy, as I am so sure you have too. It's summertime on the Jersey Shore, and we're loving it. You know how we do it in Jersey? Beach clubs, swimming pools, humidity, lots and lots and lots of good eats. So a lot of fun and sunning in my realm, and I'm hoping that you all have been enjoying your summer as well. We're going to jump right into today's topic, what a normal visit to the OBGYN looks like. And I've got to tell you, until recent events, I didn't really think that we had to talk about this. I'm not sure if you all are aware of that scandal or, issues that were occurring in California. I want to say that it was at USC, if I'm not mistaken, University of Southern California. There was an OBGYN gentleman. I'm not sure if he's a gentleman, but that's beside the point. But anyway, there was an OBGYN male physician that was head of OBGYN there for many, 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 many years. And apparently over the course of these many years, he was acting inappropriately and doing inappropriate things to patients that were visiting the clinic. And I know a lot of you are like, well, how could these things happen? Why didn't the women say something about it? Who knows? But the fact of the matter is, my favorite G.I. Joe saying, knowing is half the battle. Knowledge is half the battle. And what I will say is that a lot of times when these young girls go to these clinics or to go see the OBGYN, specifically around college age, most of them have never, ever seen an OBGYN in their lives. It's like not that out of the ordinary. So what I will tell you is that the American College of OBGYN does recommend kind of a meet and greet between the ages of 13 and 15. And I have these office visits all the time. The young ladies come in and we just sit down and we just chat about what these visits look like, what they're intended for, what you're going to get out of them, etc. And this young 13 and 15, there's no exam involved. It's just a conversation. And quite frankly, even once you get to be, late teens, early 20s, there's no exam involved most of the time. With regards to screening guidelines, pap smears do not start until the age of 21. For those of you who don't know what pap smears are, that's the screening test that we do for cervical cancer. In people that are 21 and under that are sexually active, we do annual screening for gonorrhea and chlamydia, and that actually continues through the age of 25. But what I'm going to tell you is most of the time when you go to the OBGYN, I'm not sure that an exam is even warranted most of the time unless there's something weird going on, abnormal discharge, pelvic pain that can't be otherwise explained, or, something that needs an eyeball. One of the things that I always encourage my young ladies is that, when you go into your OBGYN's office, have a conversation first, fully clothed. When I meet people for the first time, I have a face-to-face with them in their full wardrobe. I mean, how bizarre is it to meet someone for the first time and you've got like a paper gown on that opens in the front and a drape over your lap? I mean, it's a little bit, peculiar, so to speak. So meet your OBGYN fully clothed. Make sure that you are on the same page, i.e. make sure that everyone is aware of why you are there for the visit. If it's to talk about birth control, periods, etc., those things don't necessarily require an exam. So make sure that you're very upfront about that. The other thing is, if there is an exam to be had, you always have the option of having a chaperone available in the room, even if your doctor happens to be a female. If you're not quite feeling comfortable, have a chaperone or request a chaperone. That's completely within your rights. And certainly it is also always your right to refuse an exam. When I'm doing an exam, even prior to getting to that point, I like to walk patients through what it looks like. I'm going to listen to your heart and lungs. Before I even do the breast exam, I will announce, now we're going to do your breast exam. If there is a pelvic exam involved, I will announce, this is my hand right here on your inner thigh. Now I'm touching your vulva. Just kind of ease people into it so people know what to expect. So, I know it seems kind of like, oh my gosh, Dr. Angela, why are you even talking about this? But I just think that all women, young or old, irregardless of age, you have to know that you are in control and that you always have a right. You always have a choice. And just make sure that you listen to that inner voice. And if a situation doesn't feel right, you need to go with that. Trust your inner self. And if you're seeing an OBGYN that you don't think is quite a good fit for you, there are a ton of us that are out there and that are going to and that are willing to provide you with top-notch care. So I hope that this podcast has helped someone out. And remember, just because you're going to see an OBGYN doesn't mean that you necessarily are or should be having any kind of exam. I guess that's the take home. So until next time, look better, feel better, be better. I cannot wait to reconnect with you on the next episode of the Ask Dr. Angela podcast. But before I let you go, I got to give you my, tidbit, one of my favorite quotations from one of my favorite books, Life's Little Instruction Book. I'm going to give you quote number 187 that says, measure people by the size of their hearts, not the size of their bank accounts. See you next time on episode 274 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.